Alternative health system is quite widely practiced in rheumatology, not just in developing countries, even in developed countries. There was a survey done in one of the Western country where they said nearly 2/3 of the patients with rheumatological problems have accessed alternative systems in their lifetime. So in India, I can say almost 100% of my patients have tried to get alternative treatment for the rheumatological problem. So it is a common thing. So at least the patients, all of them are using it. So it is important for us to know more about it. The alternative systems do have some benefits and problems too. So I think we have to know both aspects of it. There are some benefits of alternative health system. For example, it is good in treating some of the symptoms of rheumatological problems, like pain being the main symptom. So things like acupuncture is very effective in relieving the pain. And there are a lot of other treatments which I am not an expert on alternative system, but they do have an effect on the pain is what I've been told. And the patients also have noticed it. So to relieve the pain, I think it's an extremely good thing to try alternative health system. It is also useful in patients with chronic problems. In our medicine, we are very good in treating acute problems, which means things like fracture, heart attack, stroke. So something which is very sudden onset is what we call as acute. And serious problems, I think you should not try alternative health systems at all. But if there's something like chronic problem, like a knee pain, back pain, so when you say chronic, it lasts for a very long period of time, which is not serious as well. So those are the conditions where you can try alternative health systems, because we do not have very good treatment for some of the chronic conditions. And last but not the least, we need to remember that alternative health system, rather than knowing what we should try, where we should try, we should also know where we shouldn't try, like what the acute problems I said. There are conditions which are very new and modern to our problems. So the things like rheumatoid arthritis. The documentation of rheumatoid arthritis was never known before 250 years ago. So basically, we believe that this condition is a brand new disease. For example, coronavirus. So coronavirus is a brand new disease. So if someone 6 months ago have say that there's a treatment which they have and it works, you should not believe them unless you test it first. So similarly, any new disease which has been in the market, which has been in the population for the last 200, 300 years, don't expect that you can get a relief from an alternative health system, because there's been no research or money put into alternative health systems. So we don't know it will work or not. But any disease which is old, for example, there are conditions like, say, knee pain, osteoarthritis, we know that it's been there for several thousands of years. So those are the conditions you can try alternative health system, but not new diseases. This is a common misbelief, saying that alternative health system does not have any side effects. In fact, we have seen a lot of patients who have tried some Ayurvedic and Siddha and homeopathic medications and ended up having a renal failure, kidney failure, and also liver failure. So there's so many side effects have happened. Especially one to mention is the weight loss product, Herbalife products. There's been a case in US about a liver failure happened after taking this Herbalife products, and it's a big medical legal case there. So the side effects do happen. In fact, I say the word side effect itself says that if you have an effect, you get a side effect. So if someone says that they have no side effects, that means there's no effect as well. Anything which has an effect will have a side effect. So you walk on the road, we are all prone for having accidents, but the risk is there in almost everything what we do. But if you say there's no risk, if you're just sitting and doing nothing, there's no risk, but you're not achieving anything. So there's no effects as well. So I think it's a big misconception that there are no side effects with the alternative health system. Yes, there is side effects with alternative health systems as well, and with our system too. But it all depends on the amount of efficacy and also how much it's been tested already. Then we know what side effects it can do. And side effects should not be grouped together as all the same. See, sometimes you can take one poisonous mushroom, which is a natural product, and it can kill you. But sometimes you can just eat too much of just normal rice, and that can also cause stomach pain. So side effects is what we call as a cumulative side effect based on the amount or based on the toxicity. And that holds the same for even the alternative health system products. So they all have side effects. So don't be carried away by this alternative health system practitioner saying there are no side effects. Yes, we should always continue the allopathic medicines while you're using alternative medicines as well. This is another big misconception people have, that when you're trying one form of health system for treating the disease, you have to stop the other form. That's not the case. It's like if you're eating chapati, don't eat rice. It's not like that. I think we call it complementary medicines. They all complement each other. So this is the biggest mistake with a lot of people do. When they're taking blood pressure tablets, they just stop that and then they want to try some other alternative health systems. And then we've seen so many patients later on coming back to the ICU with heart attack and strokes. So I think if you want to try any alternative health system, please do not stop your current tablets. And in fact, it is better you always consult your doctor before you stop the tablets. I think that's very, very important. If not, you can end up having problems. Dietary influences in most of the health system. There is a big weightage given to this in alternative health systems, especially like Ayurveda. And in allopathic medicine, we do give importance to it, but not all the time. So diet is very, very important. So without diet, we can't survive, we can't live. It's like, I always give an analogy of saying petrol to the car. So without petrol, the car doesn't run. But petrol is not everything. So the way we work is basically, if a part of a machine fails, you try to fix it. I know these machines are all interrelated, but still we try to fix that part of the machine rather than just trying to do the whole body service. So changing the complete diet and everything is like doing a complete oil service to the body, which is good for the body, but it is not very practical. And I think this is the problem I see with most of the alternative health system practices, and diet changes are never practical. And in fact, most of the time when the patient questions them as saying that if the treatment were not effective, they were always given a feedback saying that they did not follow the dietary principles, and that's the reason why the treatment wasn't effective. And in fact, the dietary prescription which was given was totally impractical and it cannot be followed. And that is why we believe in fixing the problem rather than actually fixing the whole body. And in modern life, I think that's not possible. But ideally, that might be right, but it is not possible all the time. So dietary influence on the health system, we talk it very specifically rather than giving a general dietary changes for most patients with the different problems. So in general, for example, in diabetes, we have to strictly follow the diet. But in patients with rheumatological problems, still today, there is no good evidence saying that any dietary intervention is of any major help to these patients. So the effect is so minimal. So we're talking at like 1 to 2%, when the treatment for rheumatological problems can give you 90% relief. So you want to put the whole effort in efficacy, which is 1 to 2%, or something which is 90%. So I would just go for 90%. Thank you.